Hi, everybody. To the AeHIN team, thank you very much for this opportunity. Excited to be presenting here tonight. It's my first time presenting on the AeHIN Hour, and thank you, everybody, for joining. So thank you for the kind introduction. My name is Dr. Fred Hersch. I'm speaking to you from Singapore, where I'm based, and pleased to be sharing with you the work that our team has been doing within Google Health and Health AI research on Open Health Stack. And really the focus of this talk is to lay the foundation for, I think, to hear about how the work that we're doing and then to really hear about Yuni and Anu and their team's great work at the Summit Institute for Development, actually bringing these kind of concepts to life. So my contact details are there, and you can also visit the website for Open Health Stack, which I'll share some more, but the links will be shared as well. Great. So just to kick off and just to frame this, so our work within Google is part of Google Health, and this is really a kind of company-wide initiative to really help billions of people be healthier. And you can see there's a lot of different groups within Google that work together and work to address this in different ways. For example, improving information on search, on YouTube, working with the public health community with data and insights, obviously research that we do around catalyzing use of AI. And our work, fits into part of the research, but also the enabling tools to transform care delivery. So how can we help developers, in different countries solve some of these problems? And our work is really grounded, when we look at some of the health equity challenges that exist, and just to try to frame that a little bit. So as many of us know, over half the world doesn't get access to essential healthcare services. And it's not just a question of access, right? So there are these 9 million preventable deaths that happen, and actually 60% of those are attributed to poor quality care. So not just lack of access, but also access to potentially poor quality care contributes to a lot of preventable death. And this mostly impacts communities in under or low resource settings. The majority of that happens to be in low middle income countries, but there are certainly pockets of low resource environments throughout high income countries as well. And like most of us, working in this field of digital health, we really see the opportunity for digital, like mobile, AI opportunities today to really be a vector for addressing this challenge, right? For bringing, quality healthcare to people at scale. But there are many challenges. These are just a few of them, but I think reflecting, over the last decade, where there's been a huge amount of investment into digital systems. One big problem has been this lack of standards. There haven't been real standards to build digital health solutions on top of. And so there have been, best efforts to try to, build, and that's led to, an array of different kind of data models that leads to kind of fragmented data. And then this is further, further impacted by a very kind of program-centric view of things. Kind of funders are very much driven, solutions for specific verticals and others. And so we end up with this fragmented and siloed data. At the same time, talking about that kind of quality problem, we know from our colleagues at the WHO and partners there, and the experience has been when there are available evidence-based guidelines, it's very difficult to actually translate those into practice. And part of that challenge is this kind of lost in translation gap, and that further contributes to poor quality care. And then I think when we look at the field, we think that poor design and usability has also kind of constrained adoption and maybe kind of constrained efforts to scale successfully. And so, all things considered, today, when we think of we think of interoperability as being very important, and we'll talk about that. But basically, building interoperable digital health solutions that can really address this quality of care issue. It's possible, but it's very challenging to do, and it's very expensive. Right? And so the mission of our team that works on this is we really want to think about how can we help to accelerate the development of these next-gen solutions that enable equitable access to high-quality AI-powered healthcare. And I just wanted to highlight a few things. First of all, we see our opportunity is how can we help this existing ecosystem, right? The vision for, I think, bringing person-centric, high-quality care is a shared vision by many in the community. And the question that we ask ourselves is what's the contribution that we think that we can make most effectively, right? And when we talk about next-gen solutions, we really think of this kind of idea of person-centric, so built on modern standards that can promote interoperability, which we see as really central to that. It's really about being data-driven, bringing some of those evidence-based decision-making to the point of care, or making it easier and faster for program officers and others to generate trusted insights from data, right? And ideally, it helps to kind of create a bit of a marketplace for innovation. So that's in two ways. One is, how can we help to bring more kind of AI capabilities, right? The surfaces for delivering those is really important. But also, how can we potentially solve some of the common problems that can then enable developers, technologists, system integrators, and others to focus on higher order problems, right? That potentially are more value adding. And just to touch on, so interoperability has for a long time really been this very central focus, and because it's seen as being the key to really unlocking this kind of person-centric view, right? We want data to follow the patient. We don't want it to be kind of like locked away in different silos. And I think 5 or so years ago, the first image here on the left is the different strategies that we're calling for, focusing, promoting interoperability. These are from donors and from the WHO in terms of their strategies. Last year, we had this great report from the World Bank, the Digital in Health report, and that really talked about this idea of how do we unlock the value of data for everyone, and spoke equally about the importance of how do we bring all these systems together and interoperability there. And then the community we were involved in and others penned this academic commentary that talked about a full stack approach, right? And this full stack is this idea of open standards, technologies, architectures, and content, and that the convergence of these things, perhaps means that we're at a point where we can really unlock this potential together. And I'd encourage people to take a look at that. So if interoperability is so key, first of all, today when we talk about interoperability, the global health, the healthcare and also the global health community is really, rallying a lot around HL7 FHIR. So FHIR stands for Fast Healthcare Interoperability Resources. It's really a new, it's new in the sense, but it's been developed over the last decade or more. It's new in that it's kind of, I think, matured over the last, handful of years, and is starting to be successfully deployed into very big systems. It's really designed to kind of address a lot of those kind of problems, right? So it's specifically designed to address the interoperability, the data exchange. And it's an open specification, meaning that everybody can kind of participate in it. There's no cost in using it. Importantly, it also brings kind of APIs for modern web applications, right? So we can now engage a whole another audience of developers that are used to building, web and mobile-based apps, and they now have, a set of APIs that they can start to play with, which is very important. And it offers an extensible healthcare schema. So particularly for some of the use cases when we're thinking about primary to community care and these types of applications, the FHIR data model is well placed, we think, to really kind of help to drive those applications. So instead of defining custom data models, there's almost a out-of-the-box opportunity to leverage something that's standards-based. And together, the importance of this is that FHIR also promotes, through kind of really thinking about terminologies and coding systems and others, this idea of syntactic and semantic interoperability. So a common syntax, we describe kind of resources in the same way, and other things, and the semantic layer is the terminologies and things. So the ICD codes, the SNOMED codes, if that's what you're using. But it really means that there's better understanding to promote that exchange of data between systems. And as I said, this really is key to achieving this person-centric care. So when we looked at this space, the question, I suppose, is, well, what are some of the challenges? Like, we know that standards are notoriously difficult to adopt, right? It's much easier to do things the way that I've always done them than to necessarily kind of stop and adopt standards. And so we, I suppose, saw that there's this kind of technical complexity there. And our goal was really to say, could we reduce that technical complexity? Can that lower the barrier to entry for developers everywhere? And would that kind of promote, acceleration of adoption of this standard, and therefore kind of, get to more interoperable health solutions, right? So when we look at this space today, there's a lot of time that's spent, if you think about an iceberg, there's a lot of things that developers are kind of maintaining under the stack, the sync capabilities, the kind of custom data models, all sorts of different pieces. And we thought that, well, with some enabling infrastructure that could take away a lot of those pain points, and can make it easier to work with these standards at the same time, you would be able to bring more interoperable solutions into systems, and also unlock like local innovation. So developers, system integrators, technologists working with designers and others can focus more on the end user problems, and less on kind of trying to maintain that full technical stack. And so that's really what Open Health Stack is. And so we launched this in March of last year. It's a suite of open source components. These are digital public goods that are designed to help developers build these next-gen healthcare apps faster. And there are three main technical components. So there's the Android FHIR SDK, which is kind of what it sounds like on the box. It's really it's a software development kit that Android app developers can use to build rich, very kind of feature-rich Android applications that leverages on-device storage, leveraging the kind of FHIR data model. It's got sync capabilities for running offline. It enables you to turn things like FHIR questionnaires for like data collection very easily into into user interfaces. But it still leaves room for being able to customize and tailor applications as well. And it has some very powerful capabilities for enabling things like the WHO SMART guidelines. So running clinical quality language on device to be able to generate evidence-based care plans and kind of compute metrics. And it's designed to work fully offline, and kind of brings all of those kind of capabilities to be able to run these applications for frontline health workers, in the community where there's poor connectivity, right? And then on the other components are more on the server side. So the FHIR Info Gateway is trying to ensure that access control policies are effectively applied, right? Again, kind of using FHIR and FHIR APIs. We want to make sure, for example, that healthcare workers in one area only have access to the patients that they should be having access to, and then we can also improve some of the sync capabilities as well there. And then the analytics piece is really about making it easier to work with FHIR data. So FHIR as a structure is very good for defining a kind of a rich patient history, a longitudinal health record. It can be notoriously difficult to run kind of common analytics on top of. And so here we provide kind of pipelines and some other capabilities to be able to run kind of in on-prem or cloud if you can, but very much kind of can be deployed into on-prem environments, very horizontally scalable pipelines that can then make it easier to build analytics workloads and solutions, dashboarding, reporting, get into advanced machine learning, data science capabilities on top of that. And just to highlight again, all of these components are designed with the specific, I suppose, realities and design constraints for low resource environments. So offline capabilities, being able to deploy into non-cloud if that's not available, but also able to kind of be an off-ramp to kind of cloud-based systems if they're available in the future. Okay. And again, I just want to highlight the importance here is that we're not building solutions to kind of compete with what's in the ecosystem today. We're really building capabilities and building blocks that then developers use in new solutions or integrate into existing solutions, right? And these components, which are on the bottom, the purple there, they can be used independently for different things, or they can be used together, and together they kind of start to form the backbone for a digital health solution or platform. We've also, we also recognize that, as the field is really kind of looking towards, how they can leverage FHIR more, there have been significant investments that have been made, and there are good systems that are being used today. And we want to demonstrate that the kind of these types of approaches actually fit very nicely together. And so we've been working with other kind of global goods in the ecosystem to look at some of these patterns for how you integrate, also how much you transition from non-FHIR to FHIR. So this is something that we're involved in, and the ecosystem is very much involved in, because ultimately what we want to do is think about, what is that best of both worlds approach, where we can start to promote, the collection of data as part of care delivery, right, as opposed to collection of data for reporting purposes. We still want to generate those reports, and but maybe we can also be building, dashboards that decision makers can be using to drive more local decisions as well. Okay. And then beyond those technical components, there's also a set of developer resources, and I'll share some examples of those. Those are tutorials like code labs and other things for developers to get started quickly. We're in the process of building out a video series that will help even more so, we think. And then also design guidelines. So bringing some of that thinking, working with partners to define some patterns for user experience, particularly on the app side today, and in the future, hopefully on the analytics side as well. And then increasingly, what our focus is on is, well, how do we help to also bring advanced integrations into these types of solutions, right? So how do we make it easier to bring, models onto device that might be doing solving computer vision problems like RDT readers, right? Or now in the future, now in the world of generative AI, how do we make it easier for developers potentially to leverage open models like Gemma, for example? And so then we think about what are the kind of enabling tools that we can bring into Open Health Stack, and that's really kind of where we're kind of looking at into the future. So in terms of some of those developer resources, as I mentioned, besides the design guidelines, we have some, I think, decent documentation. We're in the process of updating a lot of that at the moment, and that's kind of coming together quite well. We have some demo apps that you can actually build out of the Android FHIR SDK repository. We also have an end-to-end example repository, and links to all of the GitHub repositories, all of the documentation, and all of these tutorials and code labs is all available from the Open Health Stack developer website, which is there, and you'll get another link at the end as well. But here, the SDC demo app, for example, it shows you the kind of pre-built widgets that you can automatically, if you take a FHIR questionnaire, you can automatically generate either a single page or a paginated view of that questionnaire. Save that as a set of as a questionnaire response, extract that into FHIR resources, store that in the database, for example, and you can see all of that by building and playing around with these demo apps as part of the repository. These are just some of the more kind of analytics-focused tutorials. So obviously, being able to see how I can run a pipeline, effectively flatten data, and then use use SQL to power a dashboard. So there's this example. It's using Superset as an open source visualization tool, but it can be used with anything anything that has the connection to either a Spark SQL or Postgres. We have demo examples there today as well. And similarly, we want to show that there are opportunities to, if you can use the cloud, for example, and you are using things like managed FHIR servers, there are opportunities then to also integrate the frontline, the Android components, let's say, with a managed FHIR server. But equally so, you can do that with your on-prem, let's say a happy FHIR server or something like that as well. And I think something that we're very proud of is our collaboration with the World Health Organization and also the partners in this ecosystem to really advance digital health and really try to reach communities everywhere, right? So, we've been working with the WHO for the last few years. A lot of that has been focused on, bringing this kind of smart guidelines vision that you've probably heard of here in the past, but really how do we bring kind of computable evidence-based guidelines into the hands of frontline health workers, where there's authoritative content that's authored. It's now available as a set of FHIR resources, and actually if you use the Android FHIR SDK, you can actually execute some of that content. Then you can build apps around that that can then execute those kind of evidence-based pathways. And we have a vibrant and diverse ecosystem that together, as I said, there's a shared vision here, I think, and that's what's exciting about this work. It's really working together to demonstrate how we can address some of these digital health challenges and really build out the future. So we work with technical innovators, there's a range of implementing partners, and obviously global institutions who I think are aligned around a kind of common vision. And of course, we also participate in this with the standards groups, HL7 FHIR, for example. And something that we get excited about is to see the growing set of partners that are that have started to build solutions on Open Health Stack, and increasingly we're starting to see a number of those really kind of reach the field. And obviously you're going to hear about some of that later today. But we have partners building solutions in really kind of many parts of the world. We have a few case studies, again, that you can read on our developer website. And we're excited to see how we can add more of those kind of case studies as those stories evolve, and hopefully add new developers to our ecosystem. And on that front, so we've been working most recently to really kind of try to drive some capacity building and support capacity building efforts. So we did some developer boot camps in Kenya last year. We followed that up with some different formats. A one-day workshop we did in India at the Global Digital Health Summit, and then we participated together with the WHO and the broader community in a 4 or 5 day what was called an interop hackathon. That was really kind of, we took technologists through a very in-depth program, and then also showed how you can bring the smart guidelines to life by building solutions on top of Open Health Stack. And we have more. We continue to kind of run some of these, and we're increasingly looking to work with partners to be able to enable them to also be able to run these types of workshops in different countries as well. And coming towards the end, I do want to just put a call out. If people are interested to get involved, we are part of an open community that's really building around the FHIR standard, that's thinking about and excited about the potential for the smart guidelines, but really kind of trying to advance this next phase of global digital health. So there are a number of ways that you can get involved. If you're interested to learn more about the smart guidelines community, you can reach out to Ritika there. If you're a developer and you want to kind of have you started to play around, or you're looking to build a solution, you want to connect with other developers, we run weekly Open Health Stack developers calls now, and you can just drop an email to that list, and we'll add you to the calendar invites and give you examples, give you access to the notes and other things. We also are available on different forums and others, but really if you're a developer and you're interested in this, the best place to go is also to the GitHub repositories and have a look if there are issues that you want to pick up, or you have ideas for features as well. So as I mentioned, most of this information, or all of this information and more, is available on our website. You can go to ohs.dev. And then that brings us really to the end of my presentation. I just wanted to say a few words about, as an intro maybe to Dr. Yuni and Anu's presentation at the Summit Institute. So OpenSRP 2 is a platform, FHIR-based platform that's been built on Open Health Stack. So this is a collaboration between ONA, Summit Institute for Development. It's also an open source project, but this is really, I think, an exciting example of the kinds of platforms that are now being, that are FHIR native, really kind of leveraging FHIR, built on Open Health Stack. And it's built for enabling kind of community health worker workflows, integrating with facility health facilities, health workers at facilities, and also generating those insights from the data. And it's really about, I think the value here is about bringing person-centric coordinated care, and Yuni's going to talk more about this, but it's really about how can we leverage these kind of tools to then start to put together workflows around a common shared care plan that can follow a patient, that can be acted on by different types of healthcare workers, and that can ultimately also generate that data that can power insights into person, population, data, quality, and also generate those types of reports that we want to be seeing as well. And so with that, I'm going to throw it over to Dr. Yuni. Thank you, everyone. My email is there if you want to reach out. But over to Dr. Yuni, who's going to share the exciting work that the Summit Institute has been doing on the ground in Indonesia. Thank you.
So yeah, so this is SID, the Summit Institute for Development. Our location is in Lombok. That is on the right spot on the slide. It's just next to Bali Island. So our vision is actually to improve the public health and human development, with the mission is to improve the maternal, neonatal, and child health by, engaging with the community, active participation for all of the local, national, and also the global collaborators to improve the care in the life cycle approach. And we use technology as an effort to have the data-driven decision-making process, but not to forget also to put human resource as the key of all the effort or implementation that we are doing in Indonesia. So over 2 decades plus, we actually closely work with the government of Indonesia, the local leaders in this country, and of course with the community members, highlighting one of the large-scale trial to see the impact of multiple micronutrient supplementation. This is the very first activity that we did together with the local partners to assess the impact of the supplementation to reduce the infant mortality and improve the pregnancy outcomes. And it has shaped the global recommendation on multiple micronutrient supplementation. So a follow-up study on this, looking at the impact, long-term impact of the MMS on children, show that a greater effect of nurture than nature on children's cognitive development has been shown, and this then advocated and adopted by the provincial government to become a program. Then started 2015, we co-founded the OpenSMART register platform together with WHO, ONA, and other collaborators globally. And now it's being used in 17 other countries as a tool for frontline health workers. Then we also create the team-based care innovation that has been awarded the top 10 innovation globally. And moving forward, we keep develop the OpenSRP and use it in the frontline workers, used by the frontline workers to improve the care on the targeted population. And so, yeah, forget to mention that actually last year, we officially become the core partners of the government of Indonesia to enhance digital transformation in primary health care. So what actually the core innovation that we've been working on? So here you can see we transform actually the provider-centered approach into the person-centered approach. You can imagine, like, for example, a pregnant woman, if they need to seek for help, they need to go to multiple facilities and meet with multiple frontline workers. But as you can see, the data is not connected or not integrated. So what we need to have is having this family or a pregnant woman to become the center of care, where multiple frontline workers are working together to improve the care or to make sure this pregnant woman has a complete care as supposed to be receiving by her. So how to make it happen? Next. So the OpenSRP has enabled the team-based network care happening, and data can be used for action. So as mentioned earlier, SID as the co-founder, together with other collaborators, are keen to keep building the OpenSRP so it can be more advanced and used by frontline workers, especially in the context of primary care. So telling the story about the OpenSRP, the initial work of OpenSRP in Indonesia especially started in around 2007. So that, 2015, around 2015. So that initially from the deployment, a pilot deployment of a Bidan app. What is Bidan? Bidan is midwife in Indonesia. So by the deployment of Bidan app, it has initiated the launch of digital adaptation kit by WHO. Then it's further creating the reference software for antenatal care. So using the WHO guidelines, then we adopted the reference software on WHO ANC to become a Bunda app. Bunda is kind of mom in Indonesia, by integrating the recommendation or following the recommendation of antenatal care based on Indonesian regulation. So moving forward, we are working together with the WHO team, the ONA team, and of course here, we are also involved in the Smart Guideline community meeting, closely work with Fred and others. So would like to advance the Bunda app and other OpenSRP that built on Open Health Stack to become a FHIR compatible or FHIR native apps. So in August 2023, the Health Minister of Indonesia launched a program that is called Integrated Primary Health Care, or IPC, and launching also the consortium on primary health care. So Summit Institute for Development with others partners involved in this consortium and have a mandate to transform the primary health care to build on a digital system based on standard. So I was not talking much about it, but I believe the health system in Indonesia and I think in most of the countries are facing challenge, as mentioned by Fred earlier, because lack of standard and so on. So how we can enable the person-centered care in the use case of Indonesia, as you can see here, by using a standard, FHIR data standard. So the government of Indonesia has built a platform that is called Satu Sehat or One Health that actually enable the data exchange nationally from multiple platforms that comply with the guideline that are used by the Ministry of Health. And actually our team in Summit Institute for Development are also actively part of this enhancement. So yeah, we need this standard, and this is one foundation to have Satu Sehat or One Health platform in place. But is Satu Sehat answer anything? So it is answer something, but there are several approaches that we are trying to do and build with the local government in the district and closely with the community health center or the primary health centers in the country. So we are trying to build the FHIR ecosystem to improve the data utilization for action that is enabled by OpenSRP and OHS. So this is one of the approach. We're trying to utilize any source of data coming from multiple platforms or apps, whether it be FHIR compliant or non-FHIR compliant platforms. And in fact, in primary health center, for example, they are still using like manual paper form. Some of them are still using Excel sheet and other digital format that is standardized. And we are in parallel to develop the FHIR native apps. As I mentioned earlier, we have been developing the apps for midwife, for vaccinator, for the community health volunteers that we call it cadre. So these all multiple frontline workers that working in the primary care setting. If that already FHIR natives, of course, they can easily exchange data in the FHIR server. But what if the case if that is non-FHIR data sources? So we are trying to enable the data flow in to the FHIR compliance system by using translator. I would say it is translator. So it can be translated into FHIR source, and this further can utilize for having information, automated information, feeding up to the system that we call it data utilization. Yeah, this is the process. Of course, the main goal is to have all of the system connect with the Satu Sehat, which is the national platform that enable data exchange. But again, how we can utilize the data for action. So this is the one that I will explain more. Yeah, this is the full picture actually. So the data utilization informs of a message sent to, for example, a pregnant woman. When they get into the system, get registered by the midwife, for example, and they visit, they have care plan already, then they will get reminder through WhatsApp, through call center. So we deploy the infrastructure like WhatsApp API, call center, then of course develop the dashboard that enable the data can be seen by the decision makers, the head of the primary health center, even the head of the village, who can enable them to see, oh, what happened with the health status in the coverage area. So I will explain more about it. So this is actually the FHIR ecosystem to improve the service delivery that we have developed and deployed with all the 3 apps built on OpenSRP and Open Health Stack. It enables, WhatsApp, call center, and also dashboard to integrate all of the information given to beneficiaries directly and given to the stakeholders who need information, valid information for action. So we are trying to use the FHIR analytics for the dashboard as well. It's built on the Open Health Stack, of course. So we are trying to get this ecosystem works, enable all of the data, FHIR or non-FHIR, into an information that can be shared for multiple stakeholders, including the family members they are trying to help. To enable the system, how we start in the field. Of course, we built the apps together with the midwives, together with the frontline health workers. They will get feedback, and when we start deployment, we will train them. This is all of the midwives that we train in one of the district in Lombok, and after the training done, we also get them assisted by trained field workers. So they will focus on using the apps while other administrative staff or other things can be helped with the assisted and trained field workers that we send out to help the midwives in the field. And not to forget, to deploy app is not just giving app for the frontline workers. We develop a framework. A continuous human resource improvement is the key for digital transition in primary healthcare. So after they get trained, there is a certification process. There is a coaching activities where the field workers trying to help the midwife to overcome if any, anything happen with the apps or anything problems faced during the implementation. And there's also a system that we developed together with the supervisor. There's a system that we use to train and to improve the skills for the frontline workers in the field. This is the online curated certification that we developed together with the professional organization that we call Knowledge Gateway. And this Knowledge Gateway actually enable a fair, massive assessment, online proctored assessment. So it will be enable the randomization of the bank question that is actually developed together with the professional organization, containing this core knowledge that need to be adapted or need to be have by the midwives, for example, in this case. So we give this knowledge gateway, enable the very fast result coming out, and we report it to the supervisor and see what actually the gaps in knowledge and skills that need to be closed. And we collaboratively work with them to create training, like specific training, and then roll out again the training and assess again the front-end workers until we get the performance-based assessment in place. So this is the collaboration together with the MOH, especially the Institute of Health Worker Training, who enable the rolling out training for all the front-end workers across the country. Yeah, in terms of this, like the information, what kind of information actually received by the beneficiaries with enabling all the ecosystem of, FHIR, as I mentioned earlier. For instance, we send a message to remind pregnant women, don't forget to visit to visit the primary health center, because this is the due for your next NC visit. And there is also the education. There's a chatbot that, contain multiple education that should be given to pregnant women and their family members. And other infrastructure is the call center, because we know in a very rural area, sometimes they don't have any connection. So we built this call center to enable like massive predictive calls sent to hundreds, even thousands of women or family members. So they include the reminders, again, education, or even, for example, if you are due for your ultrasound schedule, so the call center team will remind you to visit the specific primary health center close in your place, so you can go to the scheduled ultrasound and others schedule, especially for pregnant women. But again, this is not only for pregnant women. Now, in the integrated primary health care that I mentioned, one of the national launching program, it is not intended only to, targeted the pregnant women, but also all of the family members. So they call it like life cycle approach service. And we are now part of this initiative and trying to build the system together with the district partners, utilizing the multiple platforms with the district. So this is the scale up plan. Now we are active in 3 out of 10 districts that were planned to cover, and planning to cover up to 10 million population across country. I think Fred earlier mentioned about AI, and fortunately, we just received a support from the Australian government to integrate AI in our data pipelines. So it will improve the decision-making process. And this also will enhance the dashboard using FHIR analytics that's built on OHS. So moving forward, utilizing AI for improving care, it's one of our agenda. Then what's next? Of course, the scale-up effort to support the government program and covering up to 10 million people. That's our next step. Then to build and deploy OpenSRP FHIR native maps together with our partners, ONA, Google, WHO, and others, and utilize and scale up the OHS data pipes for dashboard, and also AI integration, as just mentioned. Then we also part of the FHIR capacity building, like developing the curriculums and also rolling out for the curriculum FHIR for non-developers and non-developers globally. I think this one, maybe Anu wanna have some say for this slide. Over.
No, nothing much to add. I think, Yuni, you really hit all the high points. I think the main point of this slide is just highlighting that, in fact, um, these foundational structures based on the FHIR apps, OHS, et cetera, it lays a foundation that enables enhancement of all health programs into what we called next generation care. So you can see with the full interoperability of all health data, including clinical data and frontline health worker data, this really supports what we call the next generation care. And there's a core underpinning of all these different sort of IT infrastructures at the bottom. And at the top row are the various different government programs, whatever those programs might actually be. So this really shows that it's really development of the FHIR ecosystem that's the important thing. And it means that any app can join the FHIR ecosystem in some way, and any downstream use of information in the FHIR ecosystem becomes enabled. So this really, you get this all for one and one for all benefit, which I think is really the ultimate purpose of the use of FHIR, and really the tools from Open Health Stack and others really accelerate this and enable this. So those would be my final comments on this. Thank you.
Thank you.
Yes, thank you, Dr. Fred, Ms. Yuni, and Dr. Anuraj for your presentations. The questions were already answered in the chat box as well. So please don't worry if you haven't seen or read the question and answers put in the chat box. I'll be gathering them and include them when we send out the link to this webinar recording. Before we go, I'd like to check with our AeHIN leaders on the call if there's anything else they'd like to ask or say to our speakers and attendees.
I have one quick question for Fred. I'm concerned that we are running out of time, but a general question which might be useful for our members here who are attending. Fred, this question is for you. In case we need to take the assistance from Google for OHS in terms of capacity building, like what's the way to approach? You could choose to answer right now, or you could do it later. But this is one question that I repeatedly come across from members. How do we? Do they have to approach as from the ministry or from the government, or as any organization could approach you? This is something that I repeatedly come across. Thank you.
Sure, thanks, Jai. No, I think I'm happy to answer that question. I mean, anybody's welcome to approach us directly. I will just say that obviously we're a pretty small team, so there are limits in terms of what we can do. But this is where what we're definitely interested in doing is kind of trying to maybe build regional kind of capacity to further build local capacity, if you like, right? So, for example, if there's a lot of interest, let's say through the AeHIN network, then maybe what we should be thinking about is how do we set up something where we can do a kind of almost like a train the trainer, if you like, program, where we're investing in building out the materials. We want people to have access to kind of code labs and tutorials, but we'd really like, other people to be able to deliver some of that content as well. And as Anuraj has also put in the chat there, they've done some great work on, FHIR capacity building. And so, often what we would look to do is really, you want to kind of do these things together. Often you want to be, building up capacity and capabilities around FHIR, and then Open Health Stack is then great to say, okay, well, now how can I leverage that in building solutions and other things? So, if there is interest regionally, we should then come up with a plan and have a bit more of a strategy so that it's not just point-to-point type things as well. But at the same time, happy for either people to, if you're getting inbound interest, we can certainly talk more about that. But in the meantime, people are always welcome to kind of contact us directly. You'll see there's also a link on the website to get in touch with the team.
Thank you, Fred, for answering that question. It's very helpful. Thank you, Anuraj, as well as Yuni, because to bring the country example is very, very helpful, and especially with a country that with whom AeHIN has been working closely. So that was very, very helpful. Yeah, over to other questions or other leaders like here for any final questions or closure, because we are also about time. Thank you.
I'd like to turn over to Dr. Bunchai for the closing.
Thank you, Fred, Anuraj, and Yuni for the excellent presentation and knowledge. I know the 1 hour I cannot ingest all, but I think it's very useful, and we can kind of work further on that. And you know that we have the community of the interoperability lab. Indonesian also have the standard and interoperability lab in Indonesia and in many countries. So I think the Google Health, which is now working more on the FHIR standard and also the OpenStack, we can work closely to kind of the building these capacities across the Asia Pacific region. Thank you for all the participants. I think we have more to come to work together, and don't forget to attend the next three webinar that related to mostly with the standard and interoperability lab. So I think we have 8 minutes over time. So thank you again, and then see you next time.
Thank you, everyone.
Thank you. Bye.
Thank you.
Thanks, everyone.
Thank you.
Thanks, Yuni.
Yeah.
Thanks,
Bye-bye.
Anuraj. Thanks, everyone.
Thanks, everyone.
Thank you very much.
Thanks all. Bye.
Bye-bye.